evening, everyone. We're going to go ahead and get started in just a minute. Thank you so much for joining us. As you're coming in, if you could let us know where you are tuning in from, that would be terrific. Hey, Peter. We're going to give people a few more minutes to sign in, and then we'll get started. Thank you all so much for joining us. Okay, I think we can go ahead and get started. I want to welcome everybody today. As people come in, I'll just let them in. Welcome to Let's Talk the Unwinding with ACA Consumer Advocacy. I am Miranda Wilgus. I am a co-founder and director of ACA Consumer Advocacy. We are an organization committed to educating and activating the public to work together with organizations and lawmakers to fix our healthcare system, to make it equitable, affordable, accessible, universal, which it's not now, but we're working on it. Today's discussion is about what's called the Great Unwinding. During the COVID emergency, the government passed a law that allowed a lot of people to access Medicaid, but the health emergency has ended. And now we have millions of Americans who are at risk of losing their Medicaid coverage. So this is to help people, if that's your situation, navigate what to do and how to maintain healthcare coverage. Today's presentation is being recorded, and it is going to be led by Mina Schultz, renowned health policy nerd and one of our board members. And I think I'm going to turn it over to you, Mina.
Thanks, Miranda. Hello, everyone. Good to be here with you this evening. As Miranda said, my name is Mina Schultz. I am a board member here at ACA Consumer Advocacy and a hardcore health policy nerd. So I'll tell you a little bit more about me here in a sec. But for right now, I just want to welcome you all. I want to thank you for joining the conversation tonight. I'm sure that some of you've probably heard a bit about what's happening with Medicaid here with the official COVID public health emergency coming to an end, and you maybe want to learn more. And some of you all might even be current Medicaid enrollees who are looking for a little bit more information on how this process might impact you and your family. So no matter what your reason is for coming this evening, I'm really appreciative that you showed up. So tonight, as Miranda said, I'm going to be giving you a little bit of an overview of what is likely to be the largest enrollment event since the rollout of the Affordable Care Act over 10 years ago. We're talking about what is known as, in the health policy world, as Medicaid unwinding, or the end of Medicaid continuous coverage, which was in place during the height of the pandemic. So I'll give you some background on how this policy came to be, how it came to an end, and important messages that we need to share with current Medicaid enrollees that they need to hear as this process progresses. So the goal here tonight is to kind of give you all the information you need to either navigate this whole situation or take this information back to your community in the face of these huge changes to Medicaid. I do want to empower you all to use the chat box for comments and questions. Interact with each other. You know, we're here for our shared interest in helping our communities. So let's build community amongst ourselves as well. I'm seeing some familiar faces here in the chat already. So welcome, welcome. Hi, y'all. Shout out to my navigators and assisters who might be joining us. If you have any resources that you want to share in the chat box, please go ahead and do that. I know we're all here to share the knowledge, so feel free to post those for others to use. I'll pause throughout for some questions, but we should also have time at the end for some Q&A and discussion. And then one last thing before we get started that I wanted to acknowledge is, you know, while we're talking about the end of the COVID public health emergency tonight, the pandemic isn't over. You know, too many people are still getting sick and dying every day. And for many of those in our disability and chronically ill communities, not much has changed from just a couple of years ago. So while the federal government may have essentially said that the pandemic is over, you know, we as advocates have to recognize that our communities are still being impacted every day from COVID. So I just wanted to acknowledge that before we get started. So, like I said, I'm a board member of ACA Consumer Advocacy, but you might be wondering who the heck I am and why I'm here. So I got my start in healthcare advocacy and health reform policy about 10 years ago, right after the Affordable Care Act had gotten done saving my life, actually. I had recently finished up my master's degree in French and was getting ready to ship out with the Peace Corps when doctors discovered a bone tumor in my knee. And luckily, thanks to the ACA, I was on my parents' health insurance because I was under the age of 26. I would not have been able to afford, you know, the scan that caught my cancer in time. And I was able to get the treatment that I needed to save my life. So as you may or may not know, the ACA rolled out over several years. And at the time when I was finishing up treatment, the ACA marketplaces were not yet an option for me. So when I aged off my parents' plan, I had to find a job pretty darn quick that had insurance. So I took kind of a crappy job that made my life miserable, but it had coverage that I needed to get, you know, follow-up care. So after a couple of years of that, lo and behold, the job opened up to help guide people through the newly opened ACA marketplaces. After having learned just how essential life-saving and life-saving health coverage can be, I jumped on the opportunity to help my community members take advantage of this resource. And so a career path opened before me, and I haven't looked back. I served as a certified application counselor at a federally qualified health center in North Central West Virginia, where I conducted health insurance literacy education, raised awareness about the ACA, or Obamacare as it was known in West Virginia, and well, pretty much everywhere. And I helped people directly enroll in Marketplace and Medicaid coverage. So, and I was ironically a Marketplace enrollee at the time as well. And then after a few years, I made the choice to move to a more urban area where I worked for the Get Covered NYC initiative in New York City, where I connected Brooklynites to local health insurance navigators and engaged in community outreach. At that time, I also went back to school for my Master of Public Health because I wanted to get credentialed in this field a little more than being able to speak French. And then I was able to join an organization called Young Invincibles, which had been on my radar for years and years as a leader in the outreach and enrollment community. So a position opened up there, and I got to help folks like me on the ground get the tools they need to do their jobs more effectively. And that's what I do now. So that's kind of where I'm coming from. I love this work dearly, and it's my firm belief that everyone should have the right to affordable, equitable, and accessible healthcare. Okay, so let's dive into what we're all here for, a look at Medicaid unwinding. And to make sure we're all on the same page before we get into what's happening currently, I wanted to give you all some background on the changes that were made to Medicaid programs at the beginning of the COVID pandemic, which ultimately led us to this point. So way back in 2020, feels like a million years ago, at the beginning of the pandemic, Congress passed the Family's First Coronavirus Response Act. You might remember, I know it was a long time ago, that law expanded programs like SNAP and WIC, family and medical leave, employee sick leave, did a whole bunch of things to expand the safety net for folks during the pandemic. And in addition to those, had one provision that allowed for continuous coverage under Medicaid. So states were given the option to agree to what was called a maintenance of effort, or an MOE. So essentially, this was an agreement that they would pause Medicaid disenrollments in return for a small funding increase. So they don't boot people off Medicaid, they get more money to hold people on Medicaid. So in case you're not familiar with Medicaid that much, Medicaid is a state and federal partnership program, meaning both play a part in funding the program. And with that, each state reviews its enrollees' eligibility on a periodic basis to confirm whether they're still qualified for benefits. So what this MOE meant was that states could agree to pause those reviews and not kick anyone off the rolls, even if those people's circumstances changed. And in return, the states would get more federal dollars for that. So if you qualified for Medicaid based on a requirement such as income or pregnancy, you could not be disenrolled if you became, after you gave birth, or if your income increased, you couldn't be kicked off Medicaid during the pandemic, during the MOE. This kept millions of people covered during a time when access to health coverage and care was needed the most. It served as a huge safety net for those most vulnerable during the pandemic. But of course, the public health emergency was never going to last forever, and eventually the MOE would have to come to an end. So that would mean that all those people who had been able to keep their Medicaid for years without interruption would suddenly need to have their eligibility reviewed and renewed. So this is known now as unwinding, as state Medicaid agencies unwind their Medicaid rules to remove those who are no longer eligible. I want to note also that while we're talking about Medicaid unwinding, I'm saying Medicaid a lot, but CHIP is also included in this. CHIP is the Children's Health Insurance Program, which each state supports and is much like Medicaid, but is offered to children and families with slightly higher incomes than those with Medicaid. So if a family is just a bit over the income guidelines for Medicaid, they likely can enroll their children in their state CHIP program. So when we're talking about unwinding, we're talking about Medicaid and CHIP. So over the 2022 winter holidays, Congress passed the Consolidated Appropriations Act, or the CAA. So in the CAA, Congress separated the Medicaid continuous coverage, the MOE, from the rest of the public health emergency, meaning that the MOE would end sooner than the public health emergency. So CAA set a date of April 1st of this year for states to begin Medicaid disenrollments. So states could begin reviewing enrollee eligibility as early as February, but they couldn't disenroll anyone prior to April 1st. Under CAA, states will have 1 year to complete the unwinding process, which, as we'll talk about, some states will try to move faster than others. And as I mentioned, states were incentivized and all accepted increased funding to support keeping folks enrolled in Medicaid. So instead of being cut off on April 1st, that bump in funding is going to be slowly phased down over the course of this year. So states will have a little bit of extra cash as they go through this process, which is a good incentive for them not to rush. So you can see on this table here from our friends at Georgetown University that this phase down is going to look like, just a slow reduction in funding for states over the course of this year, so that hopefully they won't rush too much. There are also some guardrails in place to make sure that states use this funding well. So in order to continue receiving this funding over the course of this year, rather than just being cut off, they have to ensure that they have up-to-date contact information for consumers that they're trying to reach about their renewals. They cannot disenroll anyone on the basis of returned mail until the state has made a good faith effort to contact the individual using more than one form of communication. And states are subject to original requirements under the law. So they can't change their eligibility standards while they're doing this. They can't make changes to the program, whether people qualify or not during this time. It's got to stay the same as it was before. And then they also have to follow strict reporting requirements, which we all love. We all love data. So this is just this kind of an extensive list of what states are going to need to report and are actually starting to report now. You can see they're going to have to collect and report data on anything from renewals that they've initiated, how many folks have been successfully renewed, how many people have been disenrolled due to ineligibility. And I've highlighted one key data point here that I think may be useful for some of our advocates. Call center data is going to offer the best warning sign of how things are going in a state. It's kind of the canary in the coal mine, so to speak. So if call centers are overloaded, it's a good indicator that the state is struggling to manage its unwinding process. And then there's going to be penalties for states that don't report their data. So far, so good on that, but we've still got a year. We'll see. So starting in July 2023, if a state doesn't report this data, it's going to be penalized with a reduction in that extra funding that they're getting. So they're going to be cut off from the funding a little bit if they don't report this data. If they continue to not do that, the Department of Health and Human Services, which is the federal agency in charge of unwinding, can also require that a state implement a corrective action plan. And if they don't do that, they face a financial penalty. So along with a reduction in funding. So, good incentives for the states to report data there. And luckily, all of this data is going to be made publicly available. We wonks love that. So it's supposed to be released on a timely basis, which, with the federal government, that's pretty subjective. But some states, like I said, have already started doing that. So that makes me pretty hopeful. So as I said, this is maybe the biggest enrollment event since the implementation of the ACA over 10 years ago. So what exactly is that going to look like? Well, for one, it looks like pretty big coverage losses. There are about 90 million people who are currently enrolled in Medicaid and CHIP, and Kaiser Family Foundation estimates that anywhere from 18 to 24 of those are at risk of losing coverage. Of those, 7 million may lose coverage for procedural reasons, which I'll define here in a short minute. Actually, it probably makes sense to define it now. So I think I've said procedural reasons for a minute here, but procedural disenrollment means that something went wrong during the enrollee's renewal process. So maybe the Medicaid agency couldn't reach them, maybe there was a problem with their paperwork, maybe there was a computer glitch. For whatever reason, other than legit ineligibility, the enrollee had their coverage terminated. So these are the folks that should still be eligible based on their income or other requirements, but something like paperwork happened and caused their renewal not to go through. You can see here that this is an equity issue. 64% of Latinos losing coverage while still eligible will be due to paperwork problems, which just seems unreal. 50% of Asian American, Native Hawaiian, and Pacific Islanders will incorrectly lose coverage. 40% of Black enrollees. So these are communities that already face drastically more barriers to accessing coverage. And it's really on us as advocates to ensure that they're able to get back on the rolls. And I want to take just a second to talk about children on Medicaid. So children remain the poorest age group in the US because Medicaid eligibility guidelines for children are higher for children than they are for adults. Many are covered by this program. In fact, well over half of US children are covered by Medicaid and CHIP. So when we talk about coverage losses during unwinding, that includes high rates of children becoming disenrolled. Up to 6 million kids are expected to lose coverage over the next year, with 3 in 4 of them being disenrolled for those procedural paperwork problems, essentially. And I just want to highlight the fact because it's really relevant right now. I think many of us are aware that the pandemic had devastating impacts on our youth. Social isolation, increased social media use, familial instability, all created the perfect storm for youth mental health crisis in our country, which we're witnessing right now. So according to data from the Centers for Medicare and Medicaid Services, even back at the beginning of the pandemic in 2020, nearly a third of children ages 3 to 17 who are covered by Medicaid or CHIP had a mental, emotional, or behavioral issue. So, while we can all agree that access to mental health services for children on public programs needs to be improved, Medicaid's benefits offer kids services like screenings, counseling, medications, and other home and community-based services. So to, connect the dots here and come back to unwinding, mass coverage losses for children on Medicaid mean less access to essential services these kids depend on to stay healthy, really at a time when it's needed most. And this is just a nice graph here from the New York Times. It shows Medicaid enrollment pretty clearly during the pandemic. The Medicaid continuous coverage provision went into effect in 2020. And this graph only goes through 2021, and you can see what a sharp increase there is. So, with 90 million now enrolled, that goes up even more. And it's really important that we're going to work as hard as possible to make sure that sharp rise doesn't fall just as sharply. Now we're up against some challenges when we're trying to keep those enrollment numbers from falling. Many enrollees are not going to be familiar with the renewal process that they're about to go through. Due to high job losses during the pandemic, many people became eligible for Medicaid for the first time. They were newly entering the program. So with renewals paused for the better part of 3 years, they may have never seen a Medicaid renewal packet before. This is especially true for young adults who may have aged out of their family Medicaid coverage and will be completing their renewals for the first time without their parents. Millions of folks just simply don't know what to expect with this. And how do we even connect with these folks? So Medicaid enrollees are a highly transient population. They're more likely to move around and may understandably not think to update their contact information with their state Medicaid agency when they move. So, you can't get your renewal packet if Medicaid has the wrong address on file for you. And that's another problem. Communications and renewal packets themselves in the vast majority of states will be sent by traditional mail. And with tight timelines for tight renewal return deadlines, successful renewal kind of banks on the idea that people are checking their mail and responding promptly. So many states still don't carry out communications for their enrollees via email or text, which are definitely more common and popular modes of communication now. And then staffing issues. Just like enrollees, many agency staff have never completed a renewal. They may be unfamiliar with the process, or they may just get overloaded due to the speed with which their state is attempting to process renewals. So states that want to complete the unwinding process faster need to ensure that they have adequate staffing to be successful. And then lastly, we need to catch those who get disenrolled from Medicaid. Medicaid systems have been notoriously ineffectual at transitioning former enrollees to alternative programs like CHIP and the marketplace. Outreach and assistance from advocates is going to be just really necessary to help ensure these folks don't simply go uninsured, that they have the information, the support that they need to find and enroll in coverage elsewhere. Okay, so that was a lot of background information. But if there are any questions or comments, I'll pause right here before we go into what it's looking like and what consumers can do.
Mina, there's a question. Do you know how many total people were covered by Medicaid prior to the emergency and the extension of Medicaid following? I'm going to pop a KFF report in the chat, but can you answer that?
What does the KFF report say? I feel
Here,
like
let
it was
me,
around 50
no,
million.
that's fine.
Yeah.
It said the Medicaid CHIP enrollment increased by 21.2 million enrollees, or 29.8% from February 2020 to December 2022.
Okay, cool. I was close.
Yeah, you were right on. So I'll put the link to this in the chat.
Perfect. Okay, so as I mentioned, states were allowed to begin disenrolling folks on April 1st. Also, as I mentioned, states are not doing this all in the same timeline. So let's talk about where things stand at this moment in time. So while states were able to start unwinding in April, not all states chose to do so. In fact, as of now, there are only about 20 states that have started disenrollments. So some will start next month, some will start the month after that. Basically, it all depends on where you live when this process is going to start for you. When it comes to Medicaid programs, we have to consider that there are different populations within Medicaid who will likely go through unwinding at different times. Also, again, depending on the state where you live. So, for example, Medicaid serves kids, it serves folks with low incomes, it serves seniors, it serves people with disabilities. So some states are going to approach unwinding at the population level. For example, they may decide to process seniors first, or people with low incomes in the expansion group. In some states, Medicaid agencies are beginning with enrollees who they know are no longer eligible, or some states are saving those who are high risk for adverse outcomes for the last batch of disenrollments. I believe Oklahoma has chosen to do that. So folks who stand to lose the most by being disenrolled will be disenrolled last. Other states are going to take a time-based approach. So for example, Michigan is keeping enrollees' original renewal dates and processing based on those. So for example, if you originally gained coverage through Medicaid in September 2020, your renewal will happen in September 2023, which seems like maybe a less complicated way of doing things, but you know, states will be states. I'll also add that all states are doing, to some extent, what's called ex parte renewals. So this is a process by which states look at data from other programs like SNAP or WIC, and they use that information to keep individuals on the rolls without the need for renewal paperwork. So these folks are simply auto-renewed based on existing data. This helps reduce the number of procedural disenrollments due to missing or incorrect paperwork, which makes ex parte renewals really a helpful tool that all states should be leveraging as hard as they can over the next year. And I've just added a visual here so you can see, just it's part of a page. I've got the link down at the bottom so you can go and look up your state later if you'd like. You have on the left the month during which renewals can be initiated, meaning that's when notices can start being sent out. And on the right, you have the first month during which procedural disenrollments will begin. So if someone fails to return their paperwork, for example, that's the first month that the state would be allowed to disenroll them. So if you look at Florida, for example, renewal packets began going out in March, but Florida did not start disenrolling people who may have had paperwork problems until this month. And unfortunately, Florida has really taken advantage of the opportunity to disenroll people this month. So far, about 250,000 Floridians have lost their Medicaid coverage during unwinding, and 82% of those have been because of procedural reasons, so paperwork problems, clerical errors. Likewise, Arkansas has disenrolled 72,000, and 85% of those have been for procedural reasons. So reports out of Arkansas, which is trying to get its unwinding done in 6 months, so half the time that's allowed, it's basically trying to do it in a flash. Reports indicate that the process has just been so confusing for consumers that some are just being disenrolled without ever knowing what happened. But other states, a lot of states, are moving along at a really reasonable pace. So, you can compare those Florida numbers to those in Idaho, where only 19,000 people have lost coverage, which still a lot. I don't want to minimize that, but it's much lower than other states. And these other states are taking more time to do the renewals. They're taking the full year, and they're keeping enrollees well informed about the process. So regardless of the state you're in, are consumers ready for Medicaid unwinding? And the answer is largely no. Kaiser Family Foundation just this week released a new study related to consumer awareness of Medicaid unwinding, and the results were concerning but not unexpected. So working in this field, we've been preparing for unwinding for the better part of a year. But just anecdotally, my loved ones who are on Medicaid would have had no idea that this was coming had I not been yapping about it on and on without them wanting to hear it. But they heard it, thankfully. And it seems like this is a trend according to the KFF study. 65%, or about 2/3 of Medicaid enrollees, weren't sure if they could now lose their benefits. They weren't sure what was happening there. And that number was much higher for folks 65 and older. And I discussed earlier how many folks haven't been through Medicaid renewals before, and that's reflected here with almost half of all respondents and 68% of those over 65 never having gone through a renewal before. And again, that could be for a number of reasons, including, they never have had Medicaid before the pandemic, or they had it but had never had to complete a renewal for themselves. Again, for example, young people leaving their parents' Medicaid coverage. Also, as I mentioned, Medicaid enrollees can be especially difficult to contact. Here you can see that 1/3 of enrollees have not updated their contact information in the past year. So we'll talk about that in terms of messaging here in a minute. But once again, that number is much higher for seniors, and almost half having failed to update their contact information. And then lastly, and maybe most unfortunately, 4 in 10 enrollees wouldn't know what to do if their coverage ended. They wouldn't know where to turn. They may just stay uninsured. And, think about that in the context of the numbers of procedural disenrollments we've been seeing so far. Over 200,000 Floridians are currently losing their Medicaid while still eligible. How many of those don't know that they can just reapply for Medicaid and be approved? How many of those are going to remain uninsured without access to healthcare because of a paperwork mistake? They received this document, an official government document stating that they don't have Medicaid anymore. And so they just, what do you say to that? It's just so critical that states get this right so that those 4 in 10 people can keep going to the doctors and getting the care that they need and deserve. So if you're like me and found that last section disturbing, if not enraging, I want to make sure that we end tonight on what we can all do to make this a more successful situation for everyone involved. A lot of this will probably look familiar. It's a lot of content that we've already touched on. So 100% there are steps that enrollees can take to facilitate a smoother and more successful renewal process. First, if Medicaid can't reach you, they can't renew you. Folks must ensure their state Medicaid agency has their most up-to-date contact information. Even if they think they do, double check. And that includes address, phone number, and email. The majority of Medicaid agencies are going to be conducting this process through traditional mail. And if they don't have your correct address, you'll never get the renewal packet. If you don't get the renewal packet, you can't complete it and send it back. If you don't send it back, you become a procedural disenrollment. So, assuming Medicaid is able to reach you, you'll want to open, complete, and send back that renewal mail promptly. There will be a deadline associated with your renewal, and you don't want to miss it. If you need help completing this paperwork, there is a free resource out there, which I'll mention here in a minute. But help is available to help you through this process if you need it. And it's free. Did I say it's free? It's free. Now, if you've gone through your renewal and learned that your Medicaid coverage is ending, you do have options, but a lot of them are time sensitive. So if you're employed, your first stop should be your employer. If your employer offers coverage, they have to let you sign up for 60 days after you lose your coverage. This is called a special enrollment period, and they have to offer this to you if you're losing your Medicaid coverage. If you don't have an employer, or if that coverage is unaffordable based on government calculations, but if it's unaffordable, if it's outrageous, your next stop should be healthcare.gov. This is the federal ACA marketplace where you can sign up for a plan and more than likely qualify for financial help to bring down the monthly cost of coverage. These plans by law must cover a comprehensive set of benefits. They have to cover doctor's visits, specialists, emergency care, prescription drugs, maternity care, mental health, labs. They've got to cover all of that. And as I mentioned, financial assistance, 9 in 10 people qualify for financial help. So you may find a plan that actually fits your health and your financial needs really well. Like employer coverage, you have 60 days to enroll in an ACA marketplace plan. Also, if you don't live in a state that uses healthcare.gov, there are a few states that have their own websites. They don't use healthcare.gov, but they're still the ACA marketplaces. Healthcare.gov will direct you to the right website. So it's still the best place to start. Googling health insurance returns literally billions of hits. And the ACA marketplace is the only place where you can shop and be sure that you're not signing up for something thin or scammy. So definitely make healthcare.gov your first stop if you're looking for a private plan that you want to purchase. But most of all, given what we've been talking about with procedural disenrollments, I would really encourage folks just, based on that, to reapply if you think you've been wrongfully disenrolled. You have 90 days post disenrollment where you can get your benefits reinstated without having to go through the full application process. And really, even after that 90-day period, you can still reapply. Medicaid enrollment is year-round. So if for whatever reason you lose your benefits and you don't have a chance to reinstate them right away, you can always reapply for Medicaid at any time. And then the last thing I'll say is that if you're a parent or a guardian, don't forget about CHIP. Even if your child loses Medicaid, CHIP has higher income guidelines and provides the same level of coverage, and it might be a really great affordable option for your family. And now for that free resource that I mentioned. I think I may have seen some of these free resources come in. Y'all know who you are if you are here, but I'm talking about navigators and certified application counselors. The folks that I work with on the day-to-day, who are in their communities across the country, helping people navigate all this stuff. These are your neighbors out there, making sure everyone not only gets covered, but knows how to use their coverage. These assisters go through rigorous training and certification to be able to help you navigate health insurance. They can answer your questions, they can review your options, they can help you enroll, and they can ensure that you know what next steps you should take to access care. Assisters, when I'm talking about assisters, I'm not talking about agents or brokers. There are some excellent agents and brokers out there, but assisters have been trained to help with health insurance literacy, meaning they're available not only to enroll you, but to ensure that you understand your coverage. Before you leave their office, they can tell you how a deductible works. They can tell you which providers are in your insurance network. They can tell you which drugs are covered by your plan. And they don't work on commissions, meaning they don't get paid based on whether or not you enroll. They never put you into a certain plan or try to sell you anything. Did I mention it's free? It's a free expert resource. And they do this work because they care about their communities. This is really a sister's time to shine. They've been preparing for months now on how to help with Medicaid unwinding. They know their state Medicaid programs better than anyone, and they're ready to help, which is actually really great because that same KFF study found that 85% of enrollees stated that having expert help navigating this would be helpful. I've listed a couple of websites here where you can find your local assister to connect, either as a consumer or as an advocate. Localhealth.healthcare.gov lists both assisters and brokers on it. Get Covered America is not in every state, but you can schedule appointments directly through the website there with vetted assisters, essentially. Okay, and for the advocates on the call, here's what you can do, and it's pretty darn simple. Tell people this information. Just share everything I've talked about here tonight with everyone. Even if you don't think they have Medicaid, tell them anyway. Unfortunately, there's a pretty heavy stigma around being on a public program like Medicaid still, and people may not put it out there that this is how they access medical services. Additionally, as I learned pretty quickly from my time in West Virginia, some people don't know that they have Medicaid. They just know that they have Mass Health or Badger Care or Medi-Cal. Medicaid has different names in different states. So there's a number of reasons you may not know that the person you're speaking with is enrolled in Medicaid. But if there's one thing I learned being an enrollment assister in a rural area, it's that word of mouth is still the best way to get a message spread far and wide. No matter who you tell, the message will get to someone who needs it. So I shared earlier that I have loved ones on Medicaid who were unaware of these changes. I'm happy to report that one was able to successfully complete their renewal and will be able to continue taking their medications as needed. And that's huge. While we wish we could help everyone who's going through these procedural disenrollments, just making sure that one person is able to access the care that they need is worth the effort. What worked for my loved one is that the message came from me, a person that they trusted. You all are the trusted messengers in your families and your communities. It's one thing to hear from your state the changes are coming to Medicaid. It's different when your sister tells you to keep an eye on your mail for important notice about your health care. And while this is a national effort, it really comes down to the states. You have the ability to get familiar with your state's data and your state's needs when it comes to unwinding, if you know where to look. So get involved with your state or local healthcare advocacy organizations. I guarantee they are tracking this. Most, if not all states, have coalitions built around unwinding to coordinate stakeholders. So if your organization is interested in health and welfare of your communities, join a healthcare coalition. Even if it's not your issue area, even if it's not directly related to healthcare, it's okay. Get involved. That's how you get the information. And connect with your local navigator or certified application counselor. Then you'll have the name and the face to whom you can direct those you come into contact with who need help. Okay, one last word while we're talking about advocacy, scams. This is like a huge policy change happening right now, which means predatory behavior abounds. People afraid of losing their healthcare are super vulnerable and can easily fall prey to scams. And many states are actually already taking steps to raise awareness about this. The most common scams being seen right now alongside unwinding are text messages seeking payment for updating information or renewing coverage. There is no fee associated with renewing your Medicaid coverage anywhere Full stop. There's no fee. You shouldn't be paying anyone to renew your coverage. Consumers who get these text messages or phone calls should contact either the Federal Trade Commission or your relevant state authorities, so the Department of Insurance or your Attorney General. And then before I wrap up, I've got some really amazing resources I wanted to share if you want to know more. First, I've linked the Medicaid.gov directory where enrollees can go to look up contact information for their Medicaid agency if they have questions or if they need to update their contact information that's on file. Next, I have Young Invincible's own Unwinding Toolkit, which includes much of what we've discussed here today. It's kind of the basics for unwinding for, newer advocates or advocates who maybe don't work directly in healthcare. It's very simple, digestible information about what's happening with unwinding. Plus, it's got some key messaging in there. It includes copy and pastable social media messages, shareable graphics, in case you'd like to post to social media about this. Next, we've got a resource from the Georgetown University Center for Children and Families, which is doing probably the heaviest work on this issue in terms of national organizations. Their 50-state tracker comes with all the documents that each state has put out in terms of FAQs, communications toolkits, their state unwinding plan, and the best part, that CMS reporting data that we talked about, that states are required to put out. It can be found there once it's made available if you're into the nitty-gritty numbers. So Georgetown CCF also has a ton of great blogs on pretty much every unwinding topic you could imagine. So definitely stop by their full website if you have a minute, if you'd like to learn more. And then I've got the State Health and Value Strategies resource here. It's a great landing page with articles, blogs, resources, toolkits, all about unwinding. And then lastly, a KFF little brief. It's 10 things to know about unwinding. It's very simple. It's kind of the basics, everything you need to know. So in summary, while this is a very unfortunate situation we're finding ourselves in, to say the least, we do have the tools and the messaging needed to minimize coverage losses. Spread the word, talk to your loved ones, join coalitions, and keep up to date on what's happening. Alrighty then, we made it. Thanks for sticking with me tonight. I love talking about health policy with my fellow nerds, and not even nerds, just the regular people who are interested in this or need help. My heart is helping people get and access health coverage and care. So I just really appreciate you all kind of having that shared interest and showing up tonight. I am happy to take any questions. I haven't looked at the chat, but I'll look through it to see if there are questions. Feel free to put any comments or concerns in there too. I have my email address up here if you don't feel comfortable sharing questions in the chat here, but I'm always happy to chat that way as well.
Looks like Jose has a question.
Hi, thank you for the information and the resources, because that's the main thing. We as organizations trying to dig in and finding all those resources. I have a question about marketing materials or materials to share with the population. We as a community health workers, we are in food distributions, and sometimes what we do, we put in the flyers to remind it, if you might be losing your coverage, please call this number, contact us, etc. Is there any kind of a material, a flyer that we can share? One, and another one, if you have anything like that in Spanish or other languages.
Yes, in fact, CMS, the Centers for Medicare and Medicaid Services, who are kind of running the show here, have an excellent toolkit, which I neglected to include, but I should have. I will pop that in here before Miranda sends around the slide, so you have that link. They have
I also put a couple, I'm sorry to cut you off. I put
No.
a couple of links in the chat as resources, flyers and such that can be used. I know some organizations are doing multi languages. And I'm pretty sure most are at least doing Spanish language. I've seen some of those, but there is one flyer I know in there, and then another thing from CMS. And I know you guys have a phenomenal toolkit as well. That's not just for the professionals helping everybody, it's for the people, kind of like we do
Mhm.
for open enrollment. So absolutely, we can, if we don't have it, we can find somebody who does.
Thank
Yeah,
you.
no, the CMS one has resources in a number of languages too, and they are customizable resources as well. You can like pop your logo on there. So I will be sure to include that link in here before we send this around.
Thank you.
Mm-hmm. I see a
You know
question
what?
here. Oh, go
I
ahead.
have one other question for you. What can people who are in states that have not expanded Medicaid look forward to?
It's going to be tough. There's not a whole lot of good resources. It's really, I would suggest, again, I hate to say this. Well, no, I don't hate to say it. Talk to your local navigator or assister. They are prepared for this, especially in the Medicaid non-expansion states. They have lists of resources of where you can go to get care. There are certain programs, programs for people who have cancer, who are experiencing cancer. Some of the health insurers actually have kind of one-off programs for folks. So there's a lot of like kind of hidden resources out there, but you really want to get with someone who is familiar with those, and probably a navigator or assister is your best bet.
Somebody did ask if we would be sharing everything, and yes, we will. Does anybody else have a question?
I have a question. If, for example, you according to that, you don't qualify, and it was a mistake, or because the procedural, and you reapply, and still they're not able to, you're not able to get coverage. How many times can you apply, or it's gonna be, I don't know, is there a limit for that, for you trying to get yourself enrolled?
No limit, but I would definitely work with someone who can catch any mistakes that might be happening with your application. If you're continually getting denied and you're pretty sure, then I would definitely work with someone who's kind of a pair of fresh eyes. You can also appeal these decisions with Medicaid. It's kind of a lengthy process, but it's definitely worth doing. But no, there's no limit on how many times you can apply. You can also apply for Medicaid through healthcare.gov. You can go through the healthcare.gov application, and that will also let you know if you want to kind of double check. Just they'll let you know too if you qualify for Medicaid.
Thank you.
Mhm.
I am also putting in the chat a really good article that Vox just did that highlights what's going on with the unwinding, with numbers and state information, and something that is really simple to just share on social media or email around to family and friends who may be impacted by this but don't realize it. I would also offer ourselves as a resource. If you can't find somebody, or you know somebody who's stuck, we may not be able to get you enrolled, but we can definitely connect you with somebody who can. And our Facebook page has lots of information on it, sometimes too much, about things that are going on in the healthcare world and how to get people covered.
And definitely email me if you're seeking a navigator and you would like a recommendation. I don't know them in every single state, but YI and I have a pretty good network if you're looking for a local navigator program.
I also included our Facebook page in the chat box.
Thanks,
Our-
Jessica. Do we have any more questions?
I have a, final question, I guess. Sorry to bother you guys. I find this information super important, and I just see there were 18 people. Are you gonna be repeating this kind of meetings, or that's it?
We could.
I think it's great what
Nina's interested. We're always happy to have educational programs. We actually had a lot more people signed up, but it also is a matter of people's schedules. We can talk about it and see. I don't know, Mina, if you're up for it.
Yeah, anything that would be helpful for folks to spread this information around. I mean, we're small but mighty. It really just takes a few people to really get the word out. But I agree, given how much how low awareness is about this, it really should be getting more attention.
Have you recorded your presentation in YouTube, for example, in a link that we can share?
We will be sending out a link to the recording following within the next couple days. It's a holiday weekend, so it might be next week. And yeah, so this will totally be shareable and available online, and you can send it around to people. And we'll do our best. We're, like she said, we're small but mighty, and we are trying to lift up the information as much as we can. There is a question: is eliminating people from healthcare coverage a violation of the Affordable Care Act? Unfortunately, It's not. Because this was a special program, and Mina, correct me if I'm wrong, this was a special program put in place for a medical emergency, and it was a way to address the shameful number of people we have in this country who do not have access to health insurance or to standard health care. But it was a temporary addition. The hope was that we would be able to continue it in some way, shape, or form. But I would say this is a perfect example of why it's important that people vote. One of our main things is you have to be involved to change the way things work. And if people don't vote for people who care about health insurance and healthcare and equity, this is where we end up. We unfortunately have people in the House right now who are not just not going to continue these programs, but are now targeting Medicaid programs and well, they can't target Medicare because they were told not to, but they're targeting all kinds of programs that help those who need them most. And they're also, especially right now with the whole budget thing, if you think politics is boring, let me tell you, it impacts everything you do every day. So I'll get off my soapbox in a second, but that's really the short answer. And we do, absolutely, Peter, we need Medicaid expanded in every state. There are still 12 states that do not have Medicare expansion that was allowed under the Affordable Care Act, and all it does is punish people. And some of those very same states have the hardest requirements to qualify for Medicaid. Florida dropping 250,000 of its citizens is not that surprising based on some of the other decisions they've made regarding healthcare and health access. That is part of what we do. That's part of our remit, is to try and get people connected with lawmakers, get people into the process, and make sure people know what's going on. So if you want more programs like this, we have actually several planned over the next year on more educational things on how different things intersect with health insurance and healthcare. We'd love to see you. And if you RSVP'd, you're on our mailing list. So look for information in the future. Mina, do you have anything to add?
No, just appreciate everyone being here and spending their evening with us. It's really, it's important that more people learn about this so that we can spread the word. And I appreciate you all taking the time to be here to do that.
Absolutely. And I want to thank you for being such an amazing healthcare advocate and health policy nerd, and a member of our board, because we would not be where we are without you and your knowledge. You're one, as somebody said, you were their go-to person. You are frequently the person I call first to say, hey, wait a second, I don't get this. Yes, she is, Peter. She's absolutely the best. All right, I think we're going to wrap up unless there's any more questions. Hi, Christina. Thank you all And if you need to get a hold of us, you can reach us. My email is acaconsumeradvocacy@gmail, and we'll include that in the email that goes out. And thank you all so much for joining us and giving us part of your time. Good night.
Miranda, do you want me to stop the recording?